breast cancer care has changed a lot about diagnostic and treatment. It is so that breast cancer, as probably everybody knows, is the most common cancer in women in most countries in the world, with an incidence rising in almost all countries and age group. The 5-year survival, and that's really important, is increasing, but there is a global variation which remains very important. And the survival has risen because there is a better screening, there is a better early diagnosis, and also the treatment has already changed a lot of with not only the good chemotherapy and good hormonal therapy, but also new antibodies coming to the field in a precision like medicine, depending on what case of breast cancer. So you can say that globally there is, we are doing good, and the treatment and the diagnosis going better so that survival can rise. But there remains very important differences between the countries, and the big problem is coming in from the developing countries. One of the key points from all countries, as well developing and developed countries, is that you must work with many experts. The breast surgeon is a key player, the oncologist, the radiotherapist, the pathologist, the radiologist for the early diagnosis and for diagnosis. All these people must working together in one team, and that is very important. And that team must be coordinated by a person, a chairman, and also the care pathway must be followed by breast nurses and a lot of paramedics. So that is key in all countries, and that we can gain a lot of things. And it's not like before that one doctor sees patient and decide what to do. No, it's a team of doctors. We bring all their thoughts together, and then we have one global message for each patient. One of the main components is the multidisciplinary team, I think. And to check if you are doing right, you must have a good quality management. And in that quality management, you must have the good guidelines for each separate disciplines which tackle breast cancer, like guidelines for radiology, guidelines for the pathology, for the radiotherapist, for the medical oncologist. And these guidelines, this must be checked if you're doing what you are saying, and that you can check with quality indicators. And so it's very important that we think about what is the important indicators to follow and to see if we are doing the things right. And it's for all countries, as well developing and developed countries. So it is important that all the team is reflecting about what they are doing. And that reflection is, in essence, the jewel in the crown, I think. So it is, of course, a little bit different if you're working in a developed or a developing countries, but in essence, what we are speaking and what we try to do with our faculty is to make guidelines, basic requirements which much provided by all patients, and what we must in an ideal situation strive for. So for example, you must have all patients must be an imaging, one imaging and one pathology with something in the pathology. For example, you must do the endocrine treatment, the receptor status. You must have the nurse status. There must sometimes some things done by all patients, and that is important to have there the guidelines and to see what can be done. Another example is from the radiology, is the point what we must do with all women. Must we do a mammography, an echography, an MRI, and then we think it's very important to develop guidelines to what we really need and what can be done, and by which patients we must do additive diagnostics. Yes, that's a big problem, because what we see, that's the emerging new technology, but also the emerging new drugs, which costs a lot of money. And then we must see what is really necessary and how we can make it possible for everybody, that that they can have the minimal good things. And then we must a little bit assess value for money. And then it is very important to make recommendation what are really necessary treatments, necessary drugs, what give the best results with the limitation, the budget limitations which you have. So what we most see, that they are coming on new drugs, costly drugs, but sometimes the real added benefit is not enough. And then it's important that we discuss and see where is really the added value in a cost-effective manner. So when I see in the HER2 breast cancers, which are now a better treatment with new antibodies, what we must try to do is also de-escalate things. So perhaps we can do things less. When we see about radiation therapy, before we must radiation 25 times, now it is 15, and now recently perhaps we can do 5 times instead of 25 times. It is the same for some chemotherapy, some antibody treatment, and it's for many things. So the same in the surgery. Before it was mastectomy, now it's breast conservative surgery. So we must try to de-escalate things, and we must see that we not overtreat of do things which not really an added value. I think in COVID-19 there is a big problem of that is a global problem which all countries in the world are facing and tackle this problem, and that is difficult, and you must do it in collaboration with each other. It's the future. And the same it's for breast cancer, which is a huge problem. And when we go for the future, we must also realize that a huge problem as breast cancer, which is a bigger problem than COVID, we must do it in a global collaboration. And that is very important also for the expense of the drugs and for the best organization. An example is what we can do together, which pro and contrast is also telemedicine, teleoncology, which brings people together and which can bring integrated cancer care. But I think breast cancer, it's really a global problem, which also global figures are very important. And so we work together with the Breast Health Global Initiatives, which is a worldwide problem, initiative, which is managed by Benjamin Anderson in Seattle, to give the best possible action and treatment for all people of breast cancer worldwide. And also the studies of the Concord study, which are coordinated in London, who try to have the best figures to see how we can reflect what's happening with breast cancer and how is the evolution, which countries do better or less, and then we can learn about that, about the reflection of the outcome of breast cancer worldwide. So these things are important to set the ideas and to set it on the political agenda, to make it important to also the governments, which we must try to bring in the problem. As in COVID-19, the same is. Yeah, what I wanted to add is that it is important that governments and local authorities and national cancer plans are made by everybody, also in the low-income country, so that it's really breast cancer is put on the agenda of all countries, especially low and middle income countries, that they must work together, that they must organize their cancer care, breast cancer care, with a special attention to awareness of breast cancer, or information of the persons, to try also in some countries to understand that breast cancer exists and what it is, so that women learn about it and they can recognize it. That is very important. And another point is, if we have breast cancer research, it is also important to have it on, to try to have the participation of as much countries as possible. So, because it is really a global issue.